This cat presented to our hospital with a history of urinary obstruction. The cat was deobstructed in our critical care unit the night of admission, and this is the next morning. The cat has an indwelling urinary catheter and is hooked up to a collection device. If you look carefully at the x-ray, you can see in the posterior or in the caudal aspect of his urethra a stone lodged in the urethra. And if you look carefully in the urinary bladder, you can see 8 or 9 radiodense calculi in the central portion of his bladder. You can see faintly the calculus that is lodged in his perineal urethra. That calculus was retropulsed back into the urinary bladder. If the urinary calculus can be successfully retropulsed back into the urinary bladder, then the treatment for urethral and cystic calculi in cats is relatively simple. If the urethral calculus cannot be dislodged and cannot be retropulsed into the bladder, the treatment becomes much more difficult, oftentimes requiring a urethrostomy procedure. Once the urethral calculus has been retropulsed into the bladder, a catheter is indwelled into the urethra to act as a plug so that the calculi in the bladder will not be forced back into the neck of the bladder and urethra during routine patient prep for surgery. This is a female cat that presented to our hospital with a similar diagnosis: mechanical obstruction of the urethra with a calculus and several calculi in the bladder. In our hospital, it is routine in patients that present with cystic and urethral calculi to pass a catheter and retropulse the stones back into the bladder. This can easily be done in the female. The patient is anesthetized and placed in ventral recumbency. Closed-ended tomcat catheter is utilized and placed on the ventral midline of the vaginal vault, slid gently along the floor of the vagina, and drops right into the urethral papilla. This is an extremely easy procedure to perform and should be done in all cases of cystic and urethral calculi to ensure that the urethral calculi have been retropulsed into the bladder. This is the male cat, and you can see the positioning of the feet, of the hind legs tied forward. And what you may not be able to appreciate in this view is that there is a purse string suture in the anus. The reason the cat is positioned in this fashion and that there's a purse string suture in the anus is that the surgeon needs to have full control of the lower urinary tract in order to adequately remove all stones from the urethra and bladder. Using 0.01% betadine solution, a preputial prep is performed, and after that the routine aseptic preparation of the abdomen is performed. This is our female cat, and we're doing a similar preparation here with a purse string suture in the anus and a 0.01% prep in the vulva and vaginal vault. The bladder is approached on a ventral midline incision from umbilicus to pubis. The incision must go back to the level of the pubis in order to get adequate visualization of the bladder and the bladder neck. Care is taken not to create dead space during the approach to the ventral rectus sheath. The abdomen is opened, and a pair of Gelpi self-retaining retractors are used to enhance visualization of the posterior or the caudal aspect of the abdominal cavity. The bladder is identified and exteriorized, and any fat that is located in the ventral portion of the bladder is incised and separated so that the surgeon has clear visualization of the ventral aspect of the bladder prior to incision. Stay sutures are placed to allow traction and countertraction and enhance the surgeon's ability to be able to manipulate the urinary bladder during surgery. Once the fat has been cleared from the ventral surface of the bladder, the stay suture in the neck of the bladder can be placed. Stay sutures on either side of the proposed incision site are also placed and will facilitate exposure of the interior of the bladder, and this is particularly helpful if the surgeon does not have an assistant. A suction device is used to clear urine from the surgery site. This is back to the male, and you can see that the indwelling catheter has acted as a plug to help decrease the chances of stones inadvertently getting pushed back into the urethra. The stones are removed with a cystotomy spoon. This is back to the female, and the female has several stones that are located in the urinary bladder, and the cystotomy spoon is utilized to encourage removal from the bladder as well as the bladder neck and proximal urethra. Care is taken to remove every stone that is located in the bladder and urethra. The bladder wall is then everted, and the surgeon examines the interior of the bladder wall to determine if any source for the stones can be identified, such as a mass, a polyp, or possibly a urachal diverticulum. The neck of the bladder is then palpated digitally, and then a catheter is passed through the urethra, and the catheter is utilized to determine if any stones remain. Aggressive flushing is performed in a normograde and retrograde fashion to ensure all stones are removed. Notice in this case that stones are being flushed out through the urethra, vagina, and vulva out onto the drape. And this is encouraged by utilizing a fairly aggressive flow of saline injected through the catheter. Flushing is done until the surgeon is certain that there are no stones left behind, and then the urethra is flushed one more time. Because the most efficient way to flush the urethra is retrograde, it will be necessary to pass a catheter in this female cat from the vulva vagina and urethral papilla back up into the bladder. This is a little difficult to do when the cat is in dorsal recumbency, so the surgeon will have to suture an alternate catheter to the tip of the currently indwelled catheter to bring that catheter tip through and allow the surgeon then to do a retrograde flush of the urethra, neck of the bladder, and bladder. The suture is cut, and saline is administered in a retrograde fashion to ensure that all of the remaining stones in the urethra have been completely dislodged and flushed into the urinary bladder. Any further stones are collected and removed from the urinary bladder, and then flushing repeated. The bladder neck is explored with the cystotomy spoon, a normograde flush performed, urogenital floss to determine if there's any stones left behind, and we're ready for closure. In the male cat, it's a little bit easier to pass the catheter in a retrograde fashion. A catheter is placed in the tip of the penis. A dry sponge is utilized to occlude the penis around the catheter. And then under tremendous pressure, sterile physiologic saline solution is injected through the urethra, and any stones that are dislodged can easily be seen as they approach the ventral cystotomy incision and can either be removed via suction or the use of a cystotomy spoon. As in the female, it is important to aggressively flush retrograde and normograde, and once you think you have all of the stones completely removed from the bladder, the surgeon should perform one final lavage. Adequate visualization of the interior of the bladder is important in order to be able to retrieve all loose calculi that are retrograded from the urethra and flushed up into the neck and body of the bladder. The urogenital floss is performed to determine if there are any stones left behind. A normograde flushing is then performed. And the surgeon should see a nice stream with minimal resistance. And the final flush is a retrograde flush, making certain all stones are removed. Bladder closure is performed with a simple continuous appositional suture pattern, getting about a 3 millimeter bite in the bladder wall, and sutures should be spaced apart no further than 2 to 3 millimeters. The sutures of choice are Biasin, Monocryl, Dexon, Vicryl, or Polysorb, as these sutures tend to dissolve at a relatively rapid rate, therefore removing any potential nidus from the interior of the bladder. The bladder is returned to the abdominal cavity. The rectus sheath is closed with a simple continuous appositional suture pattern, and the skin is closed with either an interrupted or continuous suture pattern. Make no attempt to suture the subcutaneous tissues in cats, as the presence of suture in the subcutaneous tissue acts as a foreign body, and the trauma used to place the subcutaneous sutures actually increases the chances of having complications associated with thickening or granulation tissue knots that can sometimes occur in the subcutaneous tissue of cats. Postoperative x-rays should always be taken to ensure that every stone has been removed and that none have been left behind. This should be done in every case. This is our patient immediately post-op. We do not put in indwelling urinary catheters. This is the patient at discharge. And this is the patient at suture removal. This kitty cat has had a very acceptable recovery, and the owner thinks that the cat has been performing better now and acting much better than for the last 12 to 18 months. She's convinced that the cat had stones for much longer than she thought.